Hi, my name is Beverly Beal, and I am the chair of the Speakers Committee. And when the suggestion came up about doing a holistic health panel of some sort, and it was as a member request, I was very excited because when I was 36, I got a breast cancer diagnosis with no family history, in the immediate family, and of course that was quite a shock to me. After the initial round of health treatments, I began to explore what else was out there for treating the body and the mind and the spirit. And that's what kind of got me into my own line of work. But more importantly, it opened me up to the possibilities of how else can we take a look at how our bodies work, what else is going on. And so even for a while, I was marketing for a chiropractor when we lived up in the Dallas area. I loved, so basically, while I only have seen one of these panelists here in person, I have experienced all three of these modalities in some way or fashion. So without further ado, I am going to allow these women the fullest amount of time possible.
So my name is Dr. Tenesha Wards. We are a holistic practice with a functional medicine approach. We consider ourselves to focus on natural healing backed by science, and I've been in Austin since 2006. So 16 years. So my story starts where I was 15 years old, and I woke up one day unable to bend any of my joints and had extreme fatigue, brain fog, literally couldn't get out of bed. And my parents spent tens of thousands of dollars, including taking me to the Mayo Clinic, unable to figure out what was wrong with me, and missed a whole year of school. That's the first time I got really ill. The second time was after my daughter. I suffered from an autoimmune thyroid issue. A lot of stress was happening. We were expanding our practice. I thought the Lyme disease came back, but it happened to be a thyroid problem. Both times, Western medicine failed me. We went to the Mayo Clinic and they said she has depression. Here's an antidepressant. It's all in her head, those types of things. And then, of course, I had everything from lupus to MS to eventually they said idiopathic means we don't know. Um, Juvenile arthritis. She's going to be in pain the rest of her life. We're so sorry. And my mom just didn't accept that diagnosis. She's like, bull, there's a reason, and it's never lupus. If anybody's watched Dr. House, like it's never lupus, right? So all that came back. So that spurred my passion for helping other people that are diagnosed with what I think are blanket diagnoses of really just symptoms: fibromyalgia, chronic fatigue syndrome, autoimmunity. And our question and our purpose in our practice is bringing the problem to light. Why? Why are you tired every day when you wake up? Why can't you go to sleep? Why do you have pain? And that's what we thrive to figure out in our practice. And we do that through functional medicine testing. So a little bit more about me. I'm a medical director at Infinity Wellness Center, developed something called the Infinity Way program, which is the process we take our patients through. And I'll talk a little bit about that. A functional medicine practitioner certified in genetics. Love genetics. It doesn't get any more personalized than knowing your genetics. Maybe you don't detox well. That matters in the world that we're in. Or maybe your mitochondria doesn't work well, meaning you can't make energy. And, we have to figure out how to work with what you can. I also am certified in acupuncture, clinical nutritionist, applied kinesiologist, and my doctorate's in chiropractic. So I want to talk to us a little bit about burnout. I know everybody here is professionals. It's probably been 8 or 9 years, but have attended before in the past, the Metropolitan Breakfast Club. And it was already an unspoken epidemic. Throw in 2 years of crazy, and everybody right now in our practice is burned out. Everybody can't sleep, but yet they're exhausted. They can't get up, they can't function properly, and it affects everything: our jobs, our businesses, our families. I know after I had my daughter, the chronic fatigue was so bad I wasn't showing up as a present wife and mother, and that affects everybody down, and then of course yourself. So these are some of the symptoms that are from what I believe is burnout: fatigue, weight gain, anxiety. I love the exhausted but can't sleep. Does anybody suffer from that? The wired and tired, we like to call it. Definitely can spin you into early menopause, hot flashes. I have women showing up in our practice 38 years old, menopausal, because of the last 2 years of stress. I truly believe that. Forgetfulness, brain fog is a big one, and that can affect your careers. So these symptoms aren't bad. I like to say they're our body telling us to lift the hood and look inside. What is it telling us? What you do with those symptoms matters. Do we ignore them? Do we cover them up with a medication? Do we, just numb them? Or do we dig in and say, why am I tired? And so a little bit about traditional medicine versus functional medicine, which is where I would say our practice is really focused. Traditional medicine's really looking at symptoms. A lot of the time, their only tools in the tool belt is prescribing drugs or surgery, which I broke my nose twice. I'm not anti-surgery. Way too pretty not to have two nose jobs, right? So I'm not saying there's not a time and a place for that, and there's absolutely a time and a place for prescription drugs, but not for those symptoms I just listed on 2 slides ago. Really, drugs isn't going to fix that. And so oftentimes people too feel like they're just being, passively watched and ignored versus more we call an aligned health model, which is prevention, precision medicine. Let's look at your genetics. We like to work with you, look at the whole body, empower you very much like you said, to be your own doctor. Nobody's in your body. You're the only one that knows it's not right. And we really honor that. So these are the types of things that are truly the causes of those symptoms, fatigue, brain fog, and we have to dig in and figure out what it is. And I won't go into detail because this is a much longer slide. I'm abbreviating the presentation, but a good example is I had a patient who lived in a house with mold. She couldn't see the mold. It wasn't black mold, but it was causing brain fog, fatigue, anxiety, and that's what it was. She had biotoxins in her body. And so what we do, it's simple and complicated. If you're toxic in something, you have too much of a hormone, too much of a toxin, too much of an infection, we detox it. If you don't have enough, if your gut lining doesn't have enough probiotics to boost your immune system, we add those things in, but we do things like stool samples. Sorry, we're eating breakfast still, some of you. We like to talk about that in our practice. We figure out precisely exactly which probiotic, which bacteria to implant. And then I say maximize psychology. That's really stress management and adrenal glands. And this is what we've trademarked as the Infinity Way. Step 1, discover and reveal, cleanse and heal, support and enhance. And this is what we take our patients through. This is a great case study. She came to us, seizure disorders, chronic fatigue, fibromyalgia, all the BS, I believe, diagnoses that are really just symptoms, IBS, the whole thing. This was her medication list. Everything, right? Antidepressants, the whole thing. And in 7 months, this is what we were able to get her off all meds, sleeping, increased moods, get her energy back. And this was her 7-month picture. If you can see, her thyroid was enlarged right here below the neck. She had an autoimmune disorder similar to mine after my daughter, where her body was attacking her own thyroid. Well, why? Why does your body think your own tissue is public enemy number 1? That's what we want to figure out. And for her, it was toxins in her home. So I want to leave you just with some tidbits if you're specifically having fatigue or anxiety, of just things you could write down and test and take to your doctor now. Vitamin D being one of them. I love that in the COVID world right now, this has actually made news. There's been a study that says people who had a vitamin D level close to 80 recovered quicker and didn't have severe lingering long COVID symptoms, which is something we're seeing in our practice. 5 to 6 people a week. We're telehealth and we see people nationwide with post-COVID, they never got well. So Western medicine, your doctor would tell you if your vitamin D is between 30 and 100, you're good. We know that functionally for your body and your immune system to function most optimal, it needs to be closer to 60. And the study that came out with post-COVID syndrome was 80. So if you haven't had your vitamin D tested and you're fatigued, do it and see if it's close to 80. Stress, adrenal glands are 2 tiny little glands that sit on top of the kidneys. They pump out adrenaline. And right now, guess whose adrenal glands are exhausted from 2 years of we don't know what's going to happen next. We've all been in fight or flight. So there's a saliva test that you can test and also some blood chemistry labs. I can send this out if anybody wants it. Thyroid, it's always the thyroid, right? Sometimes it is, sometimes it's not. If you've been put on thyroid medication and you're still tired, 6 months later, they need to up your dose. 6 months later, they need to up your dose. If this is happening, it's probably not the thyroid, it's something underlying. And to figure out if it's autoimmunity, the BOLD, those 2 antibodies are never tested unless you've been to an endocrinologist about 8 times. And then they're like, something's wrong. So ask for those. And then infections. Epstein-Barr virus is a big one. Every single case that's walked through my door that's had long COVID, meaning they're having lingering symptoms 6 months later, has had an active Epstein-Barr virus, among other some genetic defects. I wish someone would say this on the news because this can easily be fixed and corrected. And then Lyme disease was mine, and that's a lot of fatigue, anxiety, brain fog, joint pain, things like that. I would say 80 to 90% of my fibromyalgia patients walk through the door have Lyme disease. It's an epidemic here in Central Texas with ticks. I mean, who we live in Shady Hollow. Who has deer in their front yard? Most mornings, right? They're there. And you can find me at austinholisticdoctor.com. All of our handles are Infinity Atex. That's wrong. Infinity Wellness Atex. And Dr. Tenesha Wards, natural healing backed by science, serving Austin since 2006. Thank you.
How do you best work with allopathic doctors, and how do you best advise your patients who are currently working with them?
It is harder to find somebody who will take my phone call, because I'll pick up the phone and say, hey, I have Susie in the office. She wants to get off her antidepressant. I'm regulating her 5-HTP and serotonin with herbs and nutraceuticals. Can we work together and titrate her down? And sometimes egos get involved and it doesn't go well. And sometimes it goes great. So I think it depends on the individual. I was at a conference last weekend in Atlanta, and I was sitting with an internist, a hospitalist. If you know what that is, they just work on the hospital floor and do rounds. And he was telling me how he just got burned out of hitting a wall with just medication, and he went back and got functional medicine training, and a lot of his colleagues also want to, because they're just tired of the 7-minute appointment that insurance allows, and it's hard. He's like, I'm going to have to sell my 2 Ferraris, sister, because I'm going cash and I'm making a lot more money running these 3 hospitals, but my heart isn't in it anymore. And I think if anything from the last 2 years, what we've seen in healthcare, that's a beautiful thing, that a lot of doctors are like, hey, we want to dig in and figure out how to fix this and not just cover it up. So I'm seeing a shift, a mindset shift in a lot of the MDs that I do know that are in that space. But here in town, it is hard and few and far between. And if we get one, I start sending everybody there to get their labs run, so it's not out of pocket. And then I overwhelm them and they call me and say, stop sending me people.
Okay, so the question is about how what your perspective is on treating and addressing osteoarthritis, not rheumatoid arthritis.
I believe adjustments. I don't adjust so much anymore, so I'd love to connect with you. I would take it from a perspective also of the hydration of the disc, which is like our brake pad between the vertebrae. And so I would look at running things like their omega levels, their antioxidants, inflammation levels, glucosamine, things like that can kind of bring, and collagen is a new craze, which I do like, kind of bring some hydration and stability back to the muscles, ligaments of the disc, so they're not pressing so much, and also chiropractic adjustments and acupuncture for pain management.
Okay, so the question is, how do they afford you?
Yeah, we accept health savings flex accounts. We don't bill insurance directly. We do provide a super belt for people to get reimbursed out of network. And if I could leave one legacy on this planet, is that this type of medicine is the first line of defense. And I've been on podcasts and speaking on a national level about shifting the paradigm of what we consider health. And I'm really passionate about that, to the point that we're starting a nonprofit for functional medicine patients, for the top 5% of chronically ill patients who can't afford that type of medicine, because I'm passionate that it needs to be available to everybody. In fact, we've named the nonprofit Functional Medicine for Everybody. Functional medicine for all.
Okay, so the science behind the practice, we're going to start with you.
Yeah. So for me, the science that we're using is data. We're running a lot of labs. We're running genetics. We're running stool tests. We're running hormones. We're running brain chemicals. And that's just black and white data. Your serotonin's low or it's not. So that's our tagline for functional medicine. That's specific to my practice. Things like the vitamin D study, I lean heavily on those types of studies to speak to my patients. Like, hey, yes, you're in range, but you're not functioning optimally. You're having probably most of the symptoms of low vitamin D. So yeah, I'm a little bit of a nerd like that. And I like data. I like to see the numbers. I like to see the tests.
So that's not necessarily a question as much as a marching order for all of us who have been using various modalities other than the traditional medical model, that we can all, as patients, we can use our power to encourage insurance companies and stop hiding the fact that we use alternative healthcare when we go see our Western doctors. That was the most liberating thing that I've ever done, is finally going in to talk to my oncologist to say, you know what, I did this amazing thing. It's called AAT, this advanced allergy therapeutics. It balanced my hormones out. I have no hot flashes. I have no more night sweats. I'm sleeping great. I'm good. I don't think I need to keep seeing you all the time, even though you still want to rip half of my organ systems out because you're afraid. I'm not afraid. I had the confidence because of practitioners like these to take charge of my health. So thank you, women. Thank you, ladies, so much. I so appreciate you taking the time to find your way here and share your knowledge with us.